Welcome to the Clear Down Show. I'm your host, Dr. G, with a PhD. Before we get started, remember guys, tell your friends about this show, and please like and subscribe on this episode. It really helps with the YouTube algorithms. If you like the thumbnail art, you can check it out on a much higher resolution on Instagram. And remember, leave any questions you might have throughout the week. And on the last episode of the week, I will be answering the questions in a mailbag. We've got a huge episode for you guys today. First, we're going to break down all the updates in Canada, including truckers, Ottawa, Trudeau, and a few provinces are lifting all the restrictions. So super good news. Then we're going to talk about Joe Rogan. I'll give you a little update on that story. We're going to move to mainstream media and how they've taken a total 180 stance on masks. It is just incredible to watch in real time. We'll break that down for you. The Biden administration has a new crack policy. And for our last story, we're going to talk about insurance companies. And they've shown a really strange increase in a number that you don't want to see increasing. We'll have that story and detail it all for you guys. Let's dive on in. Following up with how we've been starting the last couple of shows lately, we're going to give you guys an update on Canada. So what you're seeing here is the truckers doing a mad dash to get as much fuel as possible before midnight of February 6/7. So the scene you're seeing in the background right now is on February 6/February 7th, the Ottawa police came in and started taking fuel from the truckers and anyone else that was bringing fuel to help the truckers out. If you guys remember on the last episode, we showed a clip where they just got the announcement this was going to happen that night at midnight. And it turns out the police did follow through with their threat, and they started removing canisters and other sources of fuel from their convoy in Ottawa. Now, this is going to be, taken up in the courts at some point. I'm not entirely sure what legal doctrine is being used to achieve this end, but I can tell you it's going to be fought, and this is a really ugly scene. Speaking of an ugly scene, let's hear what these city council members of Ottawa think of these truckers.
8 of this occupation, our city is under siege. This group is emboldened by the lack of enforcement by every level of government. They are terrorizing our residents, torturing them with incessant honking, threatening them and preventing them from leading their lives. People cannot go to work or open their businesses. They cannot sleep, walk, shop, go to medical appointments, or enjoy their neighborhood. This group is a threat to our democracy. What we're seeing is bigger than just a City of Ottawa problem. This is a nationwide insurrection.
You see, it's their incessant honking. These guys are just the worst. It's a vile insurrection. So I would like to remind everybody, as far as I can tell, there's been not one violent act recorded by the police of Ottawa for these truckers. And what's really amazing to me is watching these people describe how uncomfortable these truckers are making their lives. This comes from the same class of people who have been trying for a year, hand over fist, to make everyone who's not vaccinated's lives extremely uncomfortable. They've been restricting them from bars, from restaurants, from grocery stores. They've been making them show vaccine passports. They've been doing all sorts of things to try and make people's lives uncomfortable. Now, when the truckers, who remember 80% or so are vaccinated, are making their lives uncomfortable by honking to let them know, hey, we don't like these mandates, now they're complaining about an uncomfortable life. Well, the irony is just too rich to not speak about. Hopefully this is a wake-up call to say, hey, look, maybe we should try reasoning with people and coming to, mutual agreements instead of trying to make someone else's life so uncomfortable with all of these mandates that they do what we say. So, good on the truckers. I'm glad that these city council people are uncomfortable, and maybe they'll come down and talk with the truckers and come to a reasonable agreement, although I'm skeptical. And a quick update on the GoFundMe in Ottawa. Here we have a leaked Zoom call conference where they admitted that the mayor of Ottawa had a hand in halting the GoFundMe usage. Let's listen.
We have, through the efforts of Deputy Bell, Christiane Huneau, the mayor and his staff, we've been able to shut down the GoFundMe program. That's a temporary reprieve because the funds are already moving in different directions. We are now going after supply and fuel coming into the area through investigations and intelligence operations and interdictions, all of which were underway yesterday, fully underway today.
One more time, the mayor and his staff were successful in shutting down the GoFundMe program. Just incredible. He then describes more methods they're going to use to try and stop the Freedom Convoy. Why not talk with them? Aren't these governments ostensibly supposed to represent the people? I mean, this is just unbelievable. The city of Ottawa then tried to get their tow trucks to move away the large trucks, and apparently all tow truck companies in contract with the city refused to haul away the big rigs that have gridlocked Ottawa's downtown for the second week in a row. The amount of support for this Freedom Convoy is so big. The fact that they're trying to downplay it is, it's just another sign of how insecure they are about both their position on COVID and the situation at large. Justin Trudeau had a few words to say about the truckers. Let's hear what he has to say.
Individuals are trying to blockade our economy, our democracy, and our fellow citizens' daily lives. It has to stop.
The lack of self-awareness on this guy is just amazing. His policies have blockaded the Canadian economy for the last 2 years, hands down. Justin Trudeau also made this comment, of course with a mask on this time, about Canada's response in general and moving forward, even with these truckers in this Freedom Convoy. Listen to this. This is just rich.
I can understand frustrations with mandates, but mandates are the way to avoid further restrictions or having to be restricted. As people get vaccinated, as Canadians have gotten vaccinated, we've been able to get through things. And this team is going to stay focused on doing exactly that.
Mandates are the way to less restrictions. Duh, it's so easy, guys. Don't you know? If we just keep forcing things down on you, there'll be less restrictions later on. Yeah. Man, wow. But of course, here's the news that Justin Trudeau did not want to hear. The province of Alberta will be ditching proof of vaccine programs at midnight and masking for students on Monday. That was today. The province of Saskatchewan is going to end COVID-19 proof of vaccination policy on February 14th. Mandatory masking will remain until the end of the month, and then it will be over. The pressure is working. And look at this reception to a Freedom Convoy in Vancouver, Canada. Provinces are relinquishing these restrictions and mandates, and this is great news for these truckers. Good job, Canadians. Keep up the good work. If you would like to donate anything to the Freedom Convoy, Give, Send, Go, the website, has started crowdfunding for them in lieu of the GoFundMe, and they've raised $7 million to date. So here's the website and the links in the description. Again, prayers and best of luck to these Canadians. So here's a brief update on the Joe Rogan situation that we touched on last week. Rumble has offered Joe Rogan $100 million, which is the same as the Spotify deal he currently has, to go use them as his main platform for distribution of his videos. They promise not to censor any of his videos, and he can post them all tomorrow if he wants to. So I found a couple of clips of Joe Rogan, two clips in particular from some of his podcasts. And this first one is him talking about censorship and why you shouldn't give an inch on censorship. Let's take a listen in his own words.
And you made a really good point. You said the thing is, if you censor yourself just 1%, you say, I'll just censor myself 1%. That's what they want. I'm going to make them happy. And then they're just going to keep moving it. They're just going to keep moving it forward, moving the goalposts, and providing you with more money and giving you more things, but keep moving it in a certain direction. And if you keep giving into it, they're going to have a hold of you and they can control you.
Couldn't have said it better myself, Joe. And here's Jordan Peterson, an esteemed Canadian psychologist, who explains exactly how it works in the long run, how censoring yourself or giving into this kind of censorship leads to ruin. Let's hear him say it.
Things get to terrible places one tiny step at a time. You know, if I encroach on you and I'm sophisticated about it, I'm going to encroach 2 millimeters. I'm going to encroach right to the point where you start to protest. Then I'm going to stop. Then I'm going to wait. Then you're going to calm down. Then I'm going to encroach again right to the point where you protest. Then I'm going to stop. Then I'm going to wait. And I'm just going to do that forever. And before you know it, you're going to be back 3 miles from where you started, and you'll have done it one step at a time. And then you'll go, oh, how'd I get here? And the answer was, well, I pushed you a little farther than you should have gone, and you agreed. And so then I pushed you a little farther than you should have gone again, and you agreed. And if anybody's interested in this sort of process, and this is a horrifying book, if you want to read about how this process works, you can read a book called Ordinary Men by Robert
Jordan Peterson
Browning.
is totally right. Joe should not have caved. Joe should not have removed episodes from Spotify. Look, he should take this Rumble deal and run. Take it and run and go do his show how he wants. And I think America is going to be way better off for it. Speaking of America being better off, in the last 24 to 48 hours, a bunch of mainstream media newsrooms have had a total 180 on their stance on masking and other COVID policy. This is just such an incredible breakdown. It happened so fast. I can't believe science changed so quickly. It's amazing. Or it's politics. Let's take a look at a few examples. First up, we have an old favorite, Leanna Wen, talking about the new masking policies that have just sprung up in all these states. Let's hear what she has to say.
Do you agree with the move?
I do. There was and is a time and place for pandemic restrictions, but when they were put in, it was always with the understanding that they would be removed as soon as we can. And in this case, circumstances have changed. Case counts are declining. Also, the science has changed. We know that vaccines protect very well against Omicron, which is the dominant variant. Everyone 5 and older have widespread access to vaccines. And we also know about one-way masking, the idea that even if other people around you are not wearing masks, if you wear a high quality mask, that also protects you, the wearer, too. And so in this case, I'm not saying, I don't think anyone really is saying that no one should ever wear masks, but rather that the responsibility should shift from a government mandate imposed from the state or the local district of the school. Rather, it should shift to an individual responsibility by the family, who can still decide that their child can wear a mask if needed.
Take New Jersey, the case in New Jersey, for instance. Their new case average is just over 4,000. Is that an acceptable number to do this, or are they projecting out to March 7th at this point?
I don't think we should be looking at case counts at all at this point, especially when we're dealing with a milder variant and when so many people were exposed to Omicron and therefore have at least some level of protection either through vaccination or immunity. The key number that we should be looking at is hospitalizations. If our ICUs and hospitals in that particular region are not overwhelmed, if they're not over capacity, we can set a number, for example, 75% or 80% full, then we should be able to relax all restrictions. And I actually believe that we should be starting to, with the first restriction removed, should actually be the restriction on children. Because while for adults, you could say, well, what's the harm of adults masking when they go into a grocery store? There actually is a harm that we should be discussing of children continuing.
Bit of a longer clip there. Sorry about that, guys, but it is just amazing. Do you guys recall how just 2 months ago, Leanna Wen was saying it's so important that all children mask up all the time? Even as early as last month, in January, she was calling for the masking of children. Just amazing. So she later followed this story up with this tweet. With respect to Ron Johnson, science has changed. We didn't have vaccines for children 5 to 11 until November. We now know vaccines protect well against Omicron. One-way masking with N95 can N95 protects the wearer. Change based on science doesn't mean scientists were wrong before. So a couple of points. One, it doesn't mean they were right. And if you're not right, come on, Leanna. But number two, we've known that one-way masking with N95 K95 protects wearers better than cloth masks since the beginning of the pandemic, okay? We know that vaccines actually don't protect that well against Omicron, and people like the Pfizer CEO have said so themselves. That's why they're making a new vaccine slated to release in March, I think, or April. And okay, yeah, we didn't have vaccines for children 5 to 11 until November. What? Okay. Leanna, you've been wrong on so many things during this pandemic. Own it. Own it. Stop trying to change so that you're never wrong. It's just not working out for you. Here's another video from CNN. This is Jake Tapper interviewing New Jersey Governor Phil Murphy.
As you know, most states do not have mask mandates for schools. Have you seen evidence that these mask mandates have been necessary, that the spread and mortality rates in states where they didn't have mask mandates were far worse than in places where they did have mask mandates like New Jersey?
Yeah, I mean, New Jersey is clearly the place I know the best, and God bless our precious kids no matter where they are. Please, God, they stay healthy and stay alive. There's no question that masking in our schools since the beginning of the school year has been a very smart public health step. I think we've had just over 2,600 cases of students
have worked. I mean, the numbers you just presented are impressive, but are they different from the numbers in states where they didn't have mask mandates?
Yeah, again, I know Jersey, Jake, the best, but I'm highly confident, and I'm sure our health officials could say it definitively. There's no question they've worked.
So, Governor, have masks worked? Yes, incredibly. Here are the numbers, 2,600, blah, blah, blah. Do you have data for the mask working? Yeah, I'm going to have to get to my health experts. I'm sure they can show you that, yeah, it totally worked. Yeah. Well, good on Jake for asking about data and evidence on masks. But, we're 2 years in, buddy. 2 years in. And for our last example today of news people having a complete 180 on masks, let's go to MSNBC.
Joe was talking about how to make and maintain friendships in the segment before. And one way to do that is to see people's faces, to see smiles on their faces. I mean, kids need to be with one another unrestricted in schools. There's a reason why the World Health Organization has never recommended masking children under the age of 5. They are at the highest risk for learning loss. They have a hard time with language development, reading. Kids with special needs, with disabilities are particularly suffering. And I think it's really, really time to be intellectually honest about the lack of data. The norm is seeing faces, and the burden of proof is now on the intervention. The first goal of medicine and public health is do no harm.
Oh, so now it's time to be intellectually honest. Now it's time to look at the data. Now it's time for the burden of proof to be on the people that are forcing the restrictions and mandates. Wow, what a turnaround. I cannot believe the evidence changed so much. Oh, wait, it totally hasn't. The evidence hasn't changed at all. We've known that since day one. And the reason we know that we knew that on day one are all the people that came out against it, many of which were silenced. This is just such an incredible turnaround. We'll probably have more videos for you guys throughout the week, in the coming weeks, but the speed of this turnaround is just insane. I guarantee you the next thing they're going to start telling us is, well, no one forced you to get the vaccine. You all chose to do it. No, we didn't make your lives that hard. No one forced you to do this or that. No, everyone chose to do it. Of course, guys, come on. We've always been right. This is just almost sickening, really. And regardless on your stance on the vaccine, some people want to get it, some people don't want to get it. The burden of proof needs to be on the people distributing the vaccine. The burden of proof needs to be on the people saying you have to wear masks. Why do we have to wear masks? What's your evidence? The fact that she's flipping it around now is, yeah, well, you guys know my opinion. This is just, amazing. All right, moving to some news stories. This first one comes from WSET, which is an ABC 13 affiliate in Washington. And the title of the story is, the federal government is to pay for crack pipes, meth pipes as part of a harm reduction strategy. And this was released February 8th of 2022. In the name of harm reduction, the substance abuse arm of the Health and Human Services Agency will begin providing funds to help distribute safe smoking kits for the consumption of various illicit drugs like crack, cocaine, and crystal meth. The Substance Abuse and Mental Health Services Agency has allocated roughly $30 million for a harm reduction program grant, which includes funding for syringe exchange programs, the opioid reversal drug naloxone, testing kits to detect fentanyl, and safe smoking kits and supplies, among other more traditional measures like HIV testing and safer sex resources. Harm reduction efforts like testing for infectious diseases, needle exchanges, and naloxone distribution programs are nothing new, but providing federal taxpayer funds for paraphernalia used to smoke drugs is. An HHS spokesperson reportedly confirmed to the Washington Free Beacon these safe smoking kits will provide pipes for the consumption of any illicit substance to reduce the risk of infection, which can potentially occur through cuts and sores. Seattle previously distributed meth pipes to residents in 2015, according to Reuters, but it's reportedly hard to tell the benefits such a program can have. Really? It is plausible that the intervention could be effective, said Matthew Golden, a Seattle and King County disease control official and University of Washington medical professor. When the program was launched, it's simply an unstudied idea. One nonprofit said it had conducted research which determined meth users would be less likely to inject the drug if given access to pipes, but there is little evidence to back up such a claim, Reuters reported. San Francisco has handed out crack pipes as well, according to local reporting, where allegedly an estimated 25,000 people actively inject drugs. The SAM HSA grants $30 million will be spread across 3 years, and the money will be prioritized for underserved communities that are greatly impacted by substance use disorders. Other measures funded by the grant include harm reduction vending machines, including the contents to stock them, infectious disease testing kits and medicines, vaccination services, and wound care supplies. So just getting this straight, several medical professionals could lose their livelihoods potentially, and many have lost their jobs in different hospitals for prescribing or even talking about prescribing specific drugs to treat COVID. And here the Biden administration is spending $30 million, at least part of $30 million, to give crack pipes to people to smoke crack and other things safely. Well, that's interesting. I wonder where that idea came from. For our final story, I'm going to compare two stories, and I'm going to show why I think this needs a lot of investigation and also how weird it is that we haven't heard much about it. So first up, the One America Insurance CEO says that deaths have been increasing by 40% among people ages 18 to 64. This was written January 3rd of 2022, so a little over a month ago. And it begins by saying the head of the Indianapolis-based insurance company One America said the death rate is up a stunning 40% from pre-pandemic levels among working age people. We are seeing right now the highest death rates we have seen in the history of this business. Not just at One America, the company CEO Scott Davison said during an online news conference this week. The data is consistent across every player in the business. One America is a $100 billion insurance company that has had its headquarters in Indianapolis since 1877. The company has approximately 2,400 employees and sells life insurance, including group life insurances, to employers in the state. Davison said the increase in deaths represents a huge number, and that it's not elderly people who are dying, but primarily working age people 18 to 64, who are the employees of companies that have group life insurance plans through One America. And what we saw just in the third quarter, we're seeing it continue to the fourth quarter, is that death rates are up 40% over what they were pre-pandemic. Just to give you an idea of how bad that is, a 3 sigma or a 1 in 200 year catastrophe would be a 10% increase over pre-pandemic, he said. So 40% is just unheard of. Davison was one of several business leaders who spoke during the virtual news conference on December 30th that was organized by the Indiana Chamber of Congress. Most of the claims for deaths being filed are not classified as COVID-19 deaths, Davison said. For One America, we expect the cost of this are going to be well over $100 million, and this is our smallest business, so it's having a huge impact on that. He said the cost will be passed on to employers purchasing group life insurance policies who have to pay higher premiums. The CDC weekly death counts, which reflect the information on death certificates and so have a lag of up to 8 weeks or longer, show that for the week ending November 6th, there were far fewer deaths from COVID-19 in Indiana compared to a year ago, 195 versus 336, but more deaths from other causes, 1350 versus 1319. At the same news conference where Davison spoke, Brian Tabor, the president of Indiana Hospital Association, said that hospitals across the state are being flooded with patients with many different conditions, saying unfortunately, the average Hoosier's health has declined during the pandemic. The number of hospitalizations in the state is now higher than before the COVID-19 vaccine was introduced a year ago, and in fact is higher than it's been in the past 5 years, Dr. Lindsay Weaver, Indiana's chief medical officer, said at a news conference with Governor Eric Holcomb on Wednesday. Just 8.9% of ICU beds are available at hospitals in the state, a low for the year, and lower than at any time during the pandemic. But the majority of ICU beds are not taken up by COVID-19 patients. Just 37% are, while 54% of the ICU beds are being occupied by people with other illnesses or conditions. Now, that report dovetailing with this United States Senate Committee on Homeland Security and Governmental Affairs report that was published on February 1st, and it describes Thomas Rentz, who's an attorney that represents the Department of Defense, and he's considered a whistleblower. Now let's hear some of the stats that he's been saying. According to him, there were increases in registered diagnoses in 2021 for the following medical conditions: hypertension, 2,181% increase; nervous system disease, 1,048% increase; malignant neoplasms of the esophagus, 894% increase; multiple sclerosis, 680% increase; malignant neoplasms of digestive organs, 624% increase; Guillain-Barré syndrome, 551% increase; breast cancer, 487% increase; demyelinating, 487% increase; malignant neoplasms of thyroid and other endocrine glands, 474% increase; female infertility, 472% increase; pulmonary embolism, 468% increase; migraines, 452% increase; ovarian dysfunction, 437% increase; testicular cancer, 369% increase; tachycardia, 302% increase. And these are based on 5-year averages, so he gives an example. At the roundtable, he states that the registered diagnosis for neurological issues increased 10 times, from a 5-year average of 82,000 to 863,000 in 2021. So it's not like, it went from 10 to 40. Although maybe in some cases it did. I would imagine that, Guillain-Barré from 10 to 40, that's still quite a bit, seeing how rare that disease is. But these are no small numbers. Also, this is a sworn affidavit. So this lawyer, Mr. Rentz, he's by penalty of perjury showing these claims. We should be taking this seriously. So no one's claiming to know what's the cause of this, but this is something we need to be investigating. And if you're an honest scientist, you want to investigate. You want to know what's happening. Now, why I haven't heard about this from sources like the CDC or the FDA blows my mind. They should be on top of this. This is their wheelhouse. as a personal scientist myself and an investigator, I'm going to be looking into this, and I'll let you guys know everything that I find. But keep your head on a swivel. These are really important problems we need to be looking at and addressing right now. And that's all we got for you guys today. A bit of a long show. Thanks for sticking around. Have a great rest of the day and start to the week. I'll be back again on Thursday. Please enjoy this video.
Bitch playing games with the phone.
Huh?
Let him in there again. Just put the pistol in his ass.